Коллеги, всем добрый день.
Hello, colleagues. Vyacheslav will come to us a bit later. He's presenting now, so I request our speakers to take their seats, and we're going to begin.
А сколько мы будем сейчас? Как ты хочешь?
Colleagues, hello once again. I'm very glad to welcome you in our session that is devoted to the Russian program of technical assistance to countries of Eastern Europe and Central Asia on HIV, AIDS, and other infectious diseases. Today, we're having an offline event, and although the pandemic is still on, we actually observe all the measures. And most of us are responsible people, so we have been vaccinated. That's why we can feel safe. In spite of the pandemic of COVID-19, other infectious disorders and other problems that are faced by the global community are still present. That's why it's so important for us to see that these problems are taken into account by the government, by the civil community. It's important for us to see that these problems are being solved and specific instruments are used for that. So now, I would like to invite here for the first presentation Zoya Konstantinovna Suvorova. She represents Epidemiological Center of the Russian Watchdog for Consumer Protection, and she will speak about the results of Russian programs of technical assistance to Eastern European and Central Asia countries. Actually, this presentation was to be given by the director of our institute, Vasyli Akimkin, but unfortunately he is sick. So I will present this presentation instead of him. Distinguished colleagues, it's my pleasure to represent this work on the results of research conducted by the Epidemiological Institute with 6 EECA countries. Participants of this project include Azerbaijan, Armenia, Belarus, Kyrgyzstan, Tajikistan, Uzbekistan, and several Russian regions. The research is conducted in 4 main areas. The common goal uniting these areas is a complex assessment of the impact of mass use of antiretroviral therapy on molecular genetic features of HIV, the characteristics of vulnerable population groups for HIV and TB, and epidemiological process of HIV infection in EECA countries. The research novelty of this project that we expect. For the first time, we will receive data on genetic characteristics of HIV strains that are disseminated in EECA countries. Due to the potential of developing resistance to antiretrovirus drugs, the characteristics of compliance, and susceptibility of population to the treatment of HIV and TB, for the first time, we will receive the complete characteristics of the spectrum of HIV strains with the analysis of their geographical origin and connection with factors of economic integration. So, I offer to consider the results separately in each area. The goal of the study is to prevent dissemination of HIV strains resistant to antiretrovirus therapy. So we need to study the dissemination of HIV strains that are resistant to antiretroviral therapy. Among such patients, according to the results, we have the level of resistance of HIV in patients before this therapy was from 2.8% in Uzbekistan to 16.7% in Tajikistan. The level of resistance to nucleoside inhibitor of reverse transcriptase was quite low. It was from 0.4% in Uzbekistan to 5.6% in Tajikistan. The level of resistance of HIV to non-nucleoside inhibitor of reverse transcriptase was from 2.8% in Uzbekistan to 11.4% in Tajikistan and Belarus. The cases of HIV resistance to protease inhibitors were not established. The most spread mutation of HIV resistance to NIOT was A62V, that was polymorph for the prevalent variant of HIV of subtype E6, and M41L was found in Belarus, T69D and L210W were found in Armenia. Mutation of drug resistance of HIV to non-nucleoside inhibitors of reverse transcriptase are visible on the slide. The most spread variants of HIV in these countries was subtype A6 that was encountered quite frequently in the republics of Armenia, Azerbaijan, Belarus, and circulating recombinant form O2AG that is most spread in the Republic of Uzbekistan and Republic of Tajikistan. So let's move on to the next trial. Within this trial, a complex analysis of medical, biological, and social demographic factors of the risk of developing TB in patients with HIV. Within this trial, we analyzed epidemiological data gathered in 2019. It was shown that in all countries, we saw a decrease of morbidity and mortality due to TB. Among the patients with HIV, TB was significantly higher compared with the general population. And in this slide, you can see the data on mortality due to tuberculosis over 5 years in all the republics. In this slide, you can see data on the number of patients with HIV and TB broken down by years in all republics. It is shown that among HIV patients who died due to secondary disorders, the share of people who died due to TB was minimum. In Belarus, it was 16.3%, and Vladimir region, it was 21.4%. In other countries, TB was the reason of death of almost half of HIV patients. Over the last 5 years, in most countries, we've seen an increase of drug resistance tests coverage. The least share of tested patients was in Kyrgyzstan, and in Belarus, all patients were tested on drug sensitivity. In all republics, we saw significant differences in the efficiency of anti-TB therapy combined with when tuberculosis was combined with HIV, depending on the presence or absence of multiple drug resistance. The second part of this trial is devoted to genetic polymorphism study. To study them, patients with HIV co-infected with TB. Actually, most informative genetic markers were taken from them. And as a method to define genetic polymorphism, PCR in real-time mode and PR sequencing were selected. And we considered an opportunity to include special methods for determining other genetic polymorphisms. We have considered genetic aspects of the risk of syndrome of immune system restoration in patients with TB when antiretrovirus drugs were prescribed. Unfortunately, having studied genetic polymorphisms, we actually had not started studying biological samples. Due to coronavirus, we didn't manage to take them out of the republics that participate in the trial. Following the results of this trial, one article was prepared and one thesis was prepared. We already have the information base of the risk factors of TB development in patients with HIV in the participating countries. The next study is the study of compliance of patients to observation and treatment as a method for preventing HIV. Within this study, a preliminary analysis was conducted. We analyzed the strategy deficiencies and an opportunity to develop compliance in HIV patients. These were patients from 6 countries of EECA, Republic of Tatarstan, and St. Petersburg region. And the results showed a trend to the assessment of opportunity to take care of their health. The risks of compliancy were found in 30% of participants. The most relevant needs of experts in CIS were related to organizational issues of helping patients and receiving additional knowledge. The need to improve psychological competences among the experts was 76.9%. The results we received were provided in the article that was published, and during this trial, an indicator of forecasting compliance was developed. This is compliance to observation and treatment of HIV. We've seen correlation between the indicators of self-assessment of health and readiness to visit doctor and administer therapy due to HIV. I will not dwell upon this study because later it will be represented by Valentina Belyaeva, who is responsible officer on this trial, the next trial. This is the assessment of the development of HIV epidemics by analyzing nucleotide sequences of HIV-1 and related epidemiological data on patients using phylogenetic and Bayes method of trial. This study was conducted in Armenia Republic only. It was shown during this trial that 5.5% of patients who had not taken ERT drugs had drug resistance. And I'd like to point out that resistance in naive patients grew significantly compared with 2009-2010 when it was 1.5%. And in spite of the increase of drug resistance level, the profile of established resistance mutations in most cases does not decrease the efficiency of antiretroviral drugs of the first line. The analysis of transmission clusters in Armenia, just like in the Russian Federation, has shown that there is significant underreporting of cases of infection transmission due to homosexual contacts. In the vulnerable group of men, more frequently, epidemiological connection was found between the samples from Armenia Republic and samples from the Russian Federation. And at the same time, we found low number of transmission clusters with the samples of patients from both the countries. So we can suppose that this epidemic is a bit isolated in Armenia. So we analyzed the results of 4 trials that are still being conducted in all the regions. So these trials have lasted for 2 years and we will have 1 more year. And we hope that in spite of coronavirus, we will manage to take biological samples from all republics and conduct additional trials that had been planned, and during the next conference we will be able to provide complete information on all the trials. Thank you. Thanks a lot. Indeed, an important work was conducted, and I hope that the results will be used to improve the parameters of rendering this kind of assistance. Now I would like to invite here Azam Buzurukov, who is program coordinator of UNAIDS and who has very vast experience of clinical work in international organizations. So he used to work for WHO, UNICEF, and actually I can enumerate it for a long time. I think that the work of Azam is very indicative, just like the results he achieves and his activity itself, and he will speak about the results of regional cooperation program in EECA countries. Thanks a lot for introducing me. Distinguished colleagues, this presentation was already shown to the members of the coordination committee of the program yesterday, so I will try to develop on some slides in more details. As Victoria Vladimirovna said, this program has been implemented since 2013, and this is the third year of the third phase that was launched in 2019. And the areas implemented within this third phase can be subdivided into several components. The first one is the receipt of important strategic information for preparing and implementing efficient anti-epidemiological measures. Since 2017, we've had a study devoted to recent infection cases. It was quite difficult because we started this trial in 5 countries and every country had its own particular aspects. But we prepared an overall database, and since 2019 we've seen stepwise accumulation of the necessary data. The next component is aimed at preventing HIV among key groups, and a special attention is made to migrating population. Russia is a country that accepts migrants from all the countries: Armenia, Belarus, Kyrgyzstan, Tajikistan, and since 2019 we have had our office in Uzbekistan. The flow of migrants is big, and they represent the group of population that is especially vulnerable to various diseases, including HIV and hepatitis. And we've seen a lot of events aimed at eliminating direct way of transmitting HIV in Central Asia, in particular in Kyrgyzstan and Tajikistan. And the multidisciplinary approach has proven its efficiency. This initiative started in the second phase of the program, and it has developed during the third phase. Of course, this year of pandemic has influenced the recruiting new people in these teams, but they have shown really good results. Information campaigns are also included into this component. This is one of successful measures conducted in all 5 countries of the region at the same time. Of course, each country has its specificity. Social networks are used as well as TV channels. And we can see significant work with young people everywhere. Of course, it's quite costly in terms of energy and finance, but it is quite efficient, speaking about prevention. Infection control. This is a very sensitive issue related to HIV infection in hospitals and medical facilities. Such cases exist the information about them has been published and they're being investigated because indeed these cases represent a major problem. They show low level of infectious control in the medical institutions where such cases take place. And we can see them in Middle Asia. So this problem is recognized, and within phase 2 and 3, active work has started to eliminate this problem. And we can already see a serious progress in this area and the decrease of hospital infection. This is an important indicator. So I'd like to say a few words of the results of 2019. This is a year before the pandemic. And we could see very vast extension of the events of such program. In 100 towns in Armenia, mobile services were provided to people on HIV consultation. In Belarus, the coverage of the information campaign was more than 2 million people, and in Kyrgyzstan, work was started to prevent hem contact infection and injection equipment was provided. In Tajikistan, more than 500,000 migrants and members of their families were tested on HIV. The number of clients of multidisciplinary teams in Kyrgyzstan has grown. And in November, UNAIDS office was opened once again in Uzbekistan. So the COVID year started, and it was followed by many unpleasant ramifications, because many events were stopped, many events were transferred to online mode, but in accordance with the analysis done by our experts, this kind of format did not always allow us to train experts in a qualitative manner. It was very difficult to organize everything, to get their feedback, because some things are difficult to be done online, especially speaking about training epidemiologists. So it was decided to support the services aimed at maintaining HIV prevention, especially for people with HIV, for migrants, their family members, and their birth services rendered on maintaining psychological health, especially in the beginning when it was very difficult. There were a lot of apprehensions and quite difficult. A lot of false information was given. That's why the experts that were providing the important information for COVID prevention were in high demand. As I said, this program integrated virtual consultations and various instruments were developed to collect data. So feedback was developed. For example, the Speed and Connection Fund organized virtual platforms for data collection from all the people involved in the program. In 2020, two very important international events were conducted. Russian organizations such as Russian Watchdog for Consumer Protection participated, as well as international organizations, for example, WHO, UNAIDS, UN Children Foundation, and all the representatives of ministries of all the involved countries. These symposiums, such as the impact of COVID-19 and HIV on achieving development goals and COVID-19 pandemic, that is a challenge to contemporary science. For example, speaking about the last symposium, award was given to the developers of the vaccine, and they had an opportunity to talk to the general public, and that was about 100,000 people that conducted this symposium that were able to get the data. And it is a very significant event, a very relevant event. We estimate it in a very high manner. We received a lot of good feedback from all the participants. Armenia Republic. This is a brief review. It was done yesterday, and I would like to emphasize once again that this pandemic year was very difficult, and Armenia had a war conflict during that year. and our national colleagues were rendering medical assistance. We were invited there, they were helping people there, and still very important events were being conducted. In terms of this program, for example, they conducted trainings for infectionists because there was a dramatic increase of the need in such experts. Mobile clinics were used for testing points. Sport Info Connection Foundation managed to deliver 100,000 test system and COVID-19 tests in this difficult time, and only then these tests were produced by Russian laboratories, and by demand of the Minister of Healthcare they were delivered to Armenia, Belarus Republic. 30,000 PCR tests on COVID-19 were bought there, and they managed to redistribute this means and provide for continuous treatment for 13,000 of patients. 2,000 people with HIV received services of multidisciplinary teams, and today, within this program, a national plan on COVID-19 vaccination is being developed. Kyrgyzstan Republic. Here we have the largest number of mobile clinics. We work actively and they provided services to more than 25,000 people. More than 200 units of sterilization equipment and accessories were bought to implement the program for decreasing hospital infection. Multidisciplinary teams have adapted their work and they provided food and all the necessary things, including personal protection equipment for families. Tajikistan has its own specificity. There was no overall quarantine, and mobile clinics continued their work on HIV prevention, and they also distributed necessary PPE from coronavirus. They provided about 65,000 people. Active information campaign was conducted in social media, and mobile clinics also conducted this work. And the coverage was more than 100,000 people. The net of these offices was able to render assistance to HIV-infected people and to conduct work on coronavirus prevention. In Uzbekistan, in January 2020, the program was started, but due to COVID, everything was changed. So actually, Uzbekistan was returning towards this program. Uzbekistan was present in the first phase. It was absent in phase 2, and we decided to reconnect it in phase 3. Some things were easier to restore, but we've also seen refocus on prevention and supporting people with HIV. In Samarkand, food was given for families with HIV patients. So they had to adapt in this difficult year, but in November, the first mobile clinic was delivered, and a ceremony for transferring this clinic was conducted. It was a very positive scenario. In 2021, the program implementation was started. So I actually described this program during my first slides. We continue our program on gathering epidemiological data, and we've seen active support of national program in Tajikistan that had been approved before. And we see continuation of professional relationship between Russian, Central Asian, and East European institutions. And we will continue supporting interdisciplinary teams, and we will continue strengthening infectious control in medical facilities. Now I'd like to thank all the participants of the program, all the organizations that were engaged in these programs. Indeed, this year was difficult. Many people were affected by this infection. However, Actually, our ancestors managed to win over it, and we will do so. We have a lot of instruments, a lot of potential, a lot of work experience, a lot of capacities, and we really hope that this program will continue because indeed this program has becomes well structured. It provides for a lot of people, and we hope to receive your support as well as professional support. Thank you.
Well, thank you very much for your fantastic report. It was indeed very interesting to see that the practical activity is continuous. I remember when we were doing the project to evaluate this initiative, we were impressed by the efficacy of those mobile clinics that make it possible to cover large areas with medical services and provide needed help to those who live in remote areas. Therefore, we can't possibly exaggerate the importance of your work. The second thing that I wanted to point out is the importance of awareness, raising awareness and education of the population. It is very important that people understand how to fight those infections, diseases, and as representatives of educational institutions, we shall be in line with the requirements and the current situation. So we are in demand with today's situation. As you remember, last year Russia was the head of the BRICS, and I was an expert, a leading expert there, and we came up with an initiative that together with profile institutions we could organize and promote education and training of volunteers in epidemiological field, because as we have all seen, the pandemic has shown that many health systems could not keep it under control, and certainly additional help was of great importance, and that's information we included in our final conclusion. So we shall apply it not only within BRICS, but at a wider scale. I am pretty sure that UNAIDS and other profile institutions would be very interested in it. And thank you very much again. I would like to pass floor to Valentina Belyaeva, who represents the Central Research Institute of Rospotrebnadzor, the Russian surveillance agency, and she has extensive experience in this field. She is an author of many scientific articles, and so she is a very prominent researcher. She will be talking about risks and resources of medical adherence of treatment of which infection. Valentina, the floor is yours. Thank you very much. Colleagues, may I have my slides on screen, please? So, dear colleagues, we all understand that the main player and executor of all our recommendations, our programs, is a human being. People, in other words. People want to protect their health. We want to eliminate risks of HIV and other infections. But if it happens, we expect patients to follow our recommendations and take antiretroviral therapy agents. So that means that he is dedicated. So compliance is extremely important to us in order to protect patients' health. And antiretroviral therapy is essential in this regard. The patient to see how high is compliant, how compliant he is, and what are the reasons to stop the treatment. As I said, the compliance is our key word, and this term we are going to use later on. You see that we have two regions of the Russian Federation, the Leningrad region and the Republic of Tatarstan. They took part in our trial. What did we do in 2019 and 2020? We we made a questionnaire of 1,047 patients that have been infected with HIV, 120 doctors, and 8 heads of services that provide the HIV treatment. And now, on behalf of 1,047 people living with HIV, 120 experts, and 8 heads of HIV service, also the members of our team, doctors of various specialties, epidemiologists, psychologists, and other experts, those who work in social field with our patients. This is our team that have taken part in the trial, and I think we represent a very interesting component of the reality. So what did we have in order to get an objective picture? So what stop our patient from taking the drugs? Certainly we can ask directly our patients and we can ask them what are those risks, what are the obstacles that prevent them from being compliant. We can ask experts what are the reasons based on their practice, their experience, and then compare their answers. We use both opportunities, and that's what we had. So talking about the risks, the first risk that I would like to show to you is possibility to take care independently of their health. So where our respondent says, I have no chance to take care of my health, or I have all opportunities to take care of my health. So when we see 5 or lower points, it certainly draws our attention, because that means it's a direct threat to the compliance that we shape. And we see that about 30% of our respondents from Leningradskaya region, the Tatarstan Republic, and Azerbaijan, so 30% of the patients said, I have no chance to take care of my health in an independent mode. In other regions, the picture was more favorable. So first risk was self-evaluation of ability to take care of themselves. The second is ability. Are you ready to take care of yourselves? Again, we see 5 or low points have been shown in a number of regions. We see in Azerbaijan about 30% of the patients responded to this very easy questions that they are not able to take care of my health, and certainly we should focus our attention on it and understand why, what happens in this field. And talking about particular risk, what can stop you from taking care of yourself? So as for Leningrad region, Tatarstan, and neighboring Republic of Belarus showed that about 50% of patients understand that there are certain obstacles that prevent them from from having regular treatment. Then we have regions where about 30% of the regions, such as Kyrgyzstan, Uzbekistan, Armenia, and do not understand those risks. So what risks are we talking about? First of all, it's work environment and work. So situation when our patients have no time to visit regularly their treating doctors. So we see that Uzbekistan has the most adverse situation. Then it's followed by Tatarstan, Belarus, Armenia, and Azerbaijan. And in Tajikistan, risks associated with work are not very significant, even though there are some other risks that are relevant there. So for each region we studied, we could develop a profile. For example, a picture for Leningradskaya Oblast. So less than 5% are already to visit regular doctors and take antiviral agents. About 35% say they do not have an opportunity to take care of their threat. And the biggest factor is office work that prevents them from having sustainable treatment. In Tajikistan, we see that most of patients are ready to pay visits to the doctors. They are ready to take care of themselves. But as for work as a risk, it is not among the significant factors. But here there is another risk. It's our family and the nearest environment. And also material aspect is among other risks. Therefore, we have to take into account the risks and act accordingly. As we say, our patients see one risks, and our experts see other risks. So let's have a look at the Republic of Tatarstan and see what's going on there. We see the green column is represent patients. So we said work was the number one risk. As for experts, they do not mention work among the risks. Here we have a very tentative aspect as circumstances, whatever it means. So sometimes they just forget. So 0, it is health condition. In among our patients, they believe it influences more to compliance. But the experts believe that character features of patients is what influence their compliance. Again, lockdown, patients say it was a big factor. Sometimes it could be an emotional factor. For example, lack of medications could be associated as an emotional risk. So that shall be specified. So those were risks. Again, let's talk about resources because let's think of what can help us to improve the situation. So sonogenic behavior, a very nice term. We talk about healthy lifestyle and so on. So sonogenic behavior. So we ask our respondents, I'm talking about 147 patients living with HIV, what do you do in order to take care of your health? And when we hear, I take antiretroviral agents, that sounds good. It's a good resource. So let's have a look at the share of content that is linked to antiretroviral therapy. So we see very good performance in the Republic of Tajikistan, Armenia, Azerbaijan show good figures. But what about Leningradsky region, Tatarstan, Belarus, and Kyrgyzstan? Show worse performance. So they take antiretroviral therapy, but as for awareness, here the level is much lower. So that's a very good indicator that allows us to take appropriate actions. As for our experts, we asked them, do you have enough resources to improve compliance? And these are the results. So, experts in Azerbaijan, Armenia, and Tajikistan evaluate very well their resources. As for Tajikistan, they also have good figures. As for Leningradsky region, Tatarstan, Belarus, and Kyrgyzstan, so they have different figures. So, dear colleagues, that's the picture we had. So those are the facts we got out of our study. But at the same time, we had to find an indicator, something that would make it possible to focus their compliance in future. So we've been looking for such an indicator and we finally found it. So let's have a look at the indicators. As self-assessment of health in points, ability to take care of themselves, readiness to take care of themselves, to pay visits to doctors and take antiretroviral agents. So, comparing those indicators and thanks to the efforts of our expert in medical cybernetics, we found the following factors. So the basic indicator is self-assessment of health. So if we have a high point in this regard, we can expect that the patient will be ready to take care of themselves, visit his or her doctor, and take antiretroviral therapeutical agents. So, making a conclusion of what we have found in our study, we can see that risks to be non-compliant have some regional specifics. They need to be monitored. Today it could be one risk, and in 1 month it could be another risk, and they certainly have to be eradicated. So starting then it will allow us to switch from making statistics to taking some certain measures, preventive measures, and modern technologies to work with risks will be efficient. As for low compliance, the risks are seen differently by patients and medical experts, so we have to find a compromise, a consensus in this regard. As for evaluation by patients of his or her health, make it possible to focus how ready he will be to visit doctors and take antiretroviral agents. And one of the indicators of the efficacy to shape compliance is regular visits to the doctor and antiretroviral therapy, which gives the highest results. So we can ask a very easy question: how do you take care of your health? And then you get various answers, but very seldom retroviral agents are mentioned. Thank you very much for your attention. This is our team. We are ready to publish the results of our work, and in the third issue of the journal Epidemiology, we hope to publish the main findings of our study, and we hope that this work will be continued in future. Thank you very much, dear colleagues, for your attention. Well, dear Valentina, thank you very much indeed. You covered very important aspects, and it was very interesting to see different perspectives of the patient and the medical expert. So it is very important for us to see what our programs are aimed at. So these findings are extremely important. Healthy lifestyle is important. Prevention is the key of success. But nevertheless, in order to provide comprehensive solution, it is important that patients remember about antiretroviral therapy. Thank you very much again. Now I would like to pass floor to Inora Akhmatsova, who is the head of Ministry of Health of the Republic of Kyrgyzstan. She will be talking about the Russian program of technical help to fight the HIV and AIDS in Kyrgyzstan. Ainur, the floor is yours. Hello, dear colleagues, dear participants of our international conference, Epidemiological Well-being. May I have my slides on screen, please? Well, as for the Republic of Kyrgyzstan, we have been working closely in the field of prevention of HIV for more than 30 years, and certainly within this period, the project, the original project that has been carried out by UNAIDS started to be rolled out in 2013. Today, in the Republic of Kyrgyzstan, we are carrying out the stage 3 of this project. So it had a number of specifics in its implementation that included the responsibility of Ministry of Health and Social Development in developing regulations and methodology, training of specialists in implementations, and report at the regional and national reporting at the regional and national level. As of the beginning of 2021, in Kyrgyzstan, there have been registered 10,343 cases of HIV, 9,770 count for the citizens of Kyrgyzstan, and 473 are among foreigners. 63% are men, and the rest are women. Out of all registered cases, 2,500 people died. By the end of 2020, the number of people living with HIV accounted for 10,000, and 70.5% have been diagnosed. Among the citizens of Kyrgyzstan, about 30% of people living with HIV do not know about their status, and 63% of them of patients get antiretroviral therapy out of those who are aware of their status. The gap between those who know their status and not is 37%. Most of those who do not get any treatment are people who refuse to take any treatment in medical institutions due to stigma, social stigma, or discrimination, or due to the fact that they are migrants. Most of people who do not get treatment are among key groups such as Lewin, virus suppression is achieved due to the efforts and high compliance, introduction of new schemes with the use of dolutegravir. In the country, the HIV epidemic is at a concentrated stage with a higher prevalence high prevalence among the key group of patients, such as people living with HIV, men having sex with men, and so on. And prevalence among people living taking drugs injected rain is 25,000 people. 6.6 percent account for men having sex with men, and 2% among sex workers out of 7,100 people. 11.3% account for those who are in jails out of, and that figure reached almost to 9,000 people. In recent years, we have seen the reduction of HIV detection among certain groups of population that is due to the better control of drug circulation in the country. The increase among men having sex with men is associated with sex transmission. On this slide, you see that in our country there is an increase of transmission of HIV sexually, and a higher share of women that have HIV. It's the high diagram we can see The reduction of parenteral way of transmission through injection drug consumption from 67% out of annual detection amount in 2011 to 7.2% in 2020. Also, there is an increase of HIV infections among women. If you look at the low diagram, you can see the increase of HIV in women starting from 2% up to 40% in the recent years. This trend reflects this current situation that HIV is spreading faster among the overall population, and as the recent studies show, we have to increase information awareness to prevent HIV in our republic. Cooperation with the Russian Federation is based on epidemiological situation and is aimed at prevention and on-time detection of people living with HIV. Also, we aim at introduction of new ways of control, contemporary methods of prevention of HIV among immigrants, and wide application with the use of experts from various fields, and also high compliance, therapy compliance, higher control of HIV in medical organization, and also carrying out joint research and trials in order to understand better the disease. In our country, at the moment, we introduce self-testing kits together with the Russian Federation. We have been developing regulations to change the protocol of testing, HIV testing, according to the latest recommendations of WHO. In the country today, we have a high number of express testing kits, and this work is supported at the level of medical organizations that deal with more people with symptoms of HIV in order to provide on-time response and high-quality epidemiological control. We cooperate to assess the HIV situation among especially new patients. This measure makes it possible to carry out work in order to detect the origin of the infection. At the same time, by 2020, we have been planning to study by behavior of transgenders and immigrants. Previously, it was not among our prevalence groups, but by the results of this study, we will carry out events on HIV among immigrants that account for more than 1 million people of population, so which is 15% of the population, of overall population. Together, we have developed an instruction to deliver antiretroviral agents to medical institutions and the model of antiretroviral therapy. These instructions are practical tools for all medical experts, all medical institutions in Kyrgyzstan, and non-commercial organizations. Thanks to the efforts aimed on prevention among pregnant women, we got higher results on transmission of HIV from mother to child. More than 95% of HIV pregnant women get antiretroviral therapy. As a result, vertical transmission has reduced in Kyrgyzstan from 7% that was seen in 2009 to 2% in 2020. to diagnose HIV in newborns born by HIV-positive women. We have developed diagnostics of HIV that is carried out in the first 48 hours after the birth. We have trained more than 1,000 volunteers that work in the country in order to prevent HIV and prevent transition of HIV from women to
and it allowed us to cover 72% of villages in Kyrgyzstan. We have 12 multidisciplinary teams, and thanks to that, we managed to increase the coverage 2.5 times. And the number of clients increased from 42% in 2015 to 72% of the number of registered people in 2021. The coverage of ERT therapy grew by 3.6 times from 250 people in 2013 to 1,478 people in 2021. To prevent COVID-19 infection, for the clients of this program, information materials were distributed in all multidisciplinary teams. To retain people on therapy, ARV drugs were delivered for the time of 3 months for all the patients with HIV, and to preserve compliance, online algorithm was developed, and food sets were given to the clients of multidisciplinary team that needed it. And this model of multidisciplinary approach became the basis of the order approved by the Minister of Healthcare on decentralization of services at the level of primary medical sanitary assistance. And the School of Patients for PLHIV patients was transferred to audio format, and it was placed in social networks and mobile applications for PLHIV and key groups of population that is especially important during COVID-19 pandemic. The establishment of youth center, that was already pointed out, had a goal to help young people who faced the problems of growing up, children and teenagers. And it was important for them because it was a place where they could stay in touch, share with their problems, and of course get the consultation services of psychologists and other specialists. When cooperating within the project, a manual on infectious control was reviewed. It was explained to all medical officers for the purposes of monitoring and its daily fulfillment. As it was said, within the project, in the end of 2019 and in the first quarter of 2020, 2 sets of sterilization equipment were bought. They included 6 items of equipment and furniture for equipping model centralized centers. National center in Bishkek was equipped with this equipment, and a large center in the city of Osh was equipped as well. The centers will use the equipment as training and demonstration material for the purposes of infectious control in Kyrgyzstan. And within the program of technical assistance, actually we already mentioned that a lot of mobile vehicles were supplied. And now they help us cover regions that are difficult to reach. Kyrgyzstan has small population. And we also have remote regions, remote locations, and these mobile clinics became the main points of mass testing, not only in cities, but also in villages of Kyrgyzstan. The work of these mobile clinics actually helps us to fight fear and stigmatization for PL-HIV. For today, mobile clinics have examined 218,000 people and 78,000 people were tested for HIV. And mobile clinic works not only for detecting and testing of HIV and hepatitis. During the pandemic, these mobile clinics were used also for the problem of immunoprophylaxis, for immunization in the context of COVID-19 pandemic. And of course, Kyrgyzstan also participates in all studies. So we have federal institution, and actually we cooperate with Russian Watchdog for Consumer Protection, and the research includes prevention of HIV strains dissemination that are resistant to ART therapy, formation of compliance of patients, complex analysis of medical, biological, and social demographic factors of TB risk in HIV patients. And we also participate in joint research. We conduct research together with Vector Center. This is molecular genetic monitoring of HIV dissemination in EECA countries, the selection of genetic variants of HIV-1 to be included into the collection of HIV strains. And today, we can hear a lot about the results from these trials where Kyrgyzstan participated, and other trials are going to be concluded. And in conclusion, speaking about the participation of Kyrgyzstan in our project, I'd like to point out that the main developments of the project are included into the plan of actions of Kyrgyzstan for preventing HIV for 2017-2021. The main developments of the project are included in a number of orders of the Minister of Healthcare. The Minister of Healthcare today is also a Minister of Social Development, and it takes measures on institutionalization of programs. So, out of innovative programs, these programs are transformed into routine and stable ones. And we have seen the beginning of the collection of funds from state budgetary fund to finance the work of social sphere. Within this project, training programs have been developed as well as SOPs and standards. And today, they can be used even in other countries. They are applied for training doctors and medical officers. They are also used in medical colleges and medical universities in our country. And during this time, the implementation of this project enabled us to extend the coverage, to improve the quality of diagnostics, to improve the quality of life for people living with HIV, to improve compliance and decrease stigmatization of key population groups in Kyrgyzstan. And using this opportunity today, I would like to thank our project, the Russian Federation, UNAIDS, Speeding for Connection Foundation and every employee that works within this project. Indeed, we have managed to resolve a lot of issues for sanitary epidemiological well-being in Kyrgyzstan. Thank you. I know, thank you for your presentation. The results are remarkable indeed. And I'd like to point out that they cannot be reached alone. So we really need collective work. We need cooperation and will to victory on behalf of the government of Kyrgyzstan and on behalf of the Russian Federation government. And you already mentioned the efforts taken by UNAIDS and, of course, Speeding for Connection Foundation. This is our joint work, and it's especially important in this difficult time. I'd like to emphasize once again that COVID-19 pandemic has shown us, well, could we actually think in the beginning of last year that governments of all countries will unite to solve common problems? Because we saw opposite trends. We saw that some countries became more egoistic, and still to preserve their stance, they are continuing their policy of isolation. So it's important that the representatives of the countries present in this room show a different example, and we need to continue following this way, because together we're strong. So now, I would like to give the floor to our next speaker and see the results that can be reached in another country. This is the Republic of Armenia. Marina Stan, coordinator of mobile clinic projects of the National Center of Infectious Diseases of the Minister of Healthcare of Armenia. And she will speak about the way we can resolve these problems. Marina, the floor is yours. Thank you. Distinguished colleagues, first of all, I'd like to say a few words about the epidemic of HIV in Armenia. In late 2020, in Armenia, 4,154 cases of HIV infections were registered among Armenian citizens. And the estimated number of people with HIV in Armenia is 4,850. Armenia is a country with low dissemination of HIV. It is only 0.2% among grown-ups. That is several times below the average indicator of Eastern Europe and Central Asia. And from the beginning of the epidemic, 931 deaths among HIV patients have been registered. Over the last few years, the epidemic of HIV in Armenia has acquired specific trends. For the last 10 years, among the registered cases, we've seen high share of heterosexual way of transmission. It is 80%. It has been so over the last 5 years. Another important feature of HIV pandemic in Armenia had experience of risky behavior outside Armenia, and most likely they were infected there. That is 54% of all cases we have had over the last 10 years, and if we add here their sexual partners, then the overall migration factor will reach 65%. Since 2013, we have had Russian program of assistance in Armenia for people with HIV and AIDS. The main partners are Russian Watchdog for Consumer Protection, UNAIDS, and AIDS InfoShare Foundation. The main areas of the program are as follows: strengthening of contravention to HIV work migrants and other vulnerable groups, strengthening system of prevention and control over HIV in women and children, strengthening potential of experts in HIV, improvement of complex epidemiological surveillance on HIV and research. One area of the Russian program for helping us fight HIV and AIDS includes projects for preventing HIV among work migrants and their partners that is done with the support of AIDS Infectious Foundation and UNAIDS. Somehow I cannot change the slide. Within these projects, we have seen various events that are aimed at increasing the access to testing and consultation for HIV, early diagnostics of HIV with subsequent treatment and care, migrants, their partners, representatives of communities in mobile clinics and village outpatient facilities get complex set of services include information campaign on HIV/AIDS, HIV testing, hepatitis B and C. Today, in village outpatient facilities, these services are rendered, supported by UNAIDS, and in mobile clinics. Medical services are provided with the support of AIDS Infectious Foundation. Model clinics that were given to Armenia by the Russian Federation make significant contribution to testing coverage of migrants and their partners. The first set was received in 2014 during the 4th Moscow conference. The second one was received in 2016 within the 5th conference, and the third one was received in 2019. In mobile clinics, apart from testing and consultation for HIV, hepatitis, and syphilis, ultrasound study can be done and medical consultation is given. On the whole, till 2021, we've seen about 70,000 HIV, hepatitis, and sexually transmitted diseases tests in work migrants, their partners, and representatives of communities in mobile clinics and village outpatient facilities. HIV diagnosed people were registered, and subsequently, specialized treatment was given to them. In 2020, from the 1st of July to the 31st of December, 6,121 tests on HIV was done, as well as tests for hepatitis and sexually transmitted diseases among migrants, their partners, and community representatives in mobile clinics and village outpatient facilities. These mobile clinics started work in July 2020. The programs were adapted due to the difficult epidemiological situation. Such villages were selected where the epidemiological situation was quite calm, and specific menus were developed on infectious control for people who worked in mobile clinics and beneficiaries. They were adapted to new realia. In 2020, 6 cases of HIV were found. 70 beneficiaries had positive result on rapid test for diagnostics of hepatitis B, 77 beneficiaries hepatitis C, and 17 beneficiaries had positive result on rapid test for syphilis diagnostics. Patients were referred to the necessary experts for further examination and treatment. Thanks to the implementation of the project for migrants, we've seen increased access to HIV tests, the diagnostics, and timely treatment. HIV tests in communities participating in the projects becomes available. Negative attitude to HIV tests is overcome. Stigmatization and discrimination to patients with HIV is decreased. We see formation of safe behavior skills and a habit of testing among seasonal work migrants. In the years 2013-2020, about 350 villages and towns participated in this project, and more than 70,000 labor migrants, their partners, and community representatives have been covered. Within the project, we see COVID-19 tests that are done with rapid test systems on immunoglobulin IMG, on the basis of mobile treatment and diagnostics complex. The employees of Checkpoint were tested, as well as the employees of National Center of Infectious Diseases are regularly tested for COVID-19. I'd like to point out that mobile medical clinics during this time use laboratory potential, and they were actively involved in fighting coronavirus infection. In mobile clinics, diagnostics of coronavirus infection was done with PCR method. In mobile clinics, we've seen tests for coronavirus infection. These tests were done for the employees of the Committee of State Profit under the government of Armenia Republic. Rapid test systems for the presence of immunoglobulin IMG was done during the second wave of coronavirus infection in October in mobile clinics. Once again, outpatient facility admitted patients with coronavirus. Mobile clinics are also used for various public events that provide for popularization of HIV tests in our community, especially among young people. Change of stereotypes on HIV tests, so people would understand that HIV tests are important for their health and for prevention of infectious transmission. Public events are conducted in provinces and in the capital. During these events, people who want it receive an opportunity to get free anonymous tests on HIV, hepatitis B, C, and syphilis using express testing method within 15 to 20 minutes, and they can learn what their status is. Over the whole time of these projects, in 13 Armenian cities, more than 75 public events have been conducted. More than 7,000 people have been examined and learned their HIV status. Armenia is a small country, and this is a good indicator for us. In 2020, due to the lockdown, all public events, unfortunately, were postponed to 2021. Within the Russian program of assistance supported by UNAIDS in 6 Armenian regions, we have women community. This community strives for decreasing the vulnerability of women to HIV and increasing their motivation to be tested on HIV. Since 2014, more than 4,500 beneficiaries participated in the meetings of this community. And we also have resource centers. In 25 villages and towns of 7 Armenian regions, the centers continued their work on preventing HIV among teenagers and adolescents using various information technologies. Since 2014 till 2020, about 5,000 teenagers had visited the resource centers. In 25 villages and towns, workshops were conducted. The method that was used was peer-to-peer method, and 100 employees were trained. In 2020, all the works were adapted for the new reality. In 2020, a seminar for 25 representatives of the self-governance organs was conducted. These are spheres of healthcare and social well-being. To improve the qualification of medical personnel in terms of HIV and AIDS, since 2010, the National Healthcare Institute has used training course devoted to HIV infection on the basis of National Center of Infectious Diseases. This training course is aimed at developing the potential of medical officers on the issue of prevention and treatment of HIV. In 2017-2020, this training course has been supported by UNAIDS within the Russian Program of Assistance. In 2017, online course was implemented. It was supported by UNAIDS within Russian Program of Assistance. And within the Russian Program of Assistance, we have seen the implementation of joint research. And in spite of difficult epidemiological situation in the country due to coronavirus, we see continuation of joint research. This research was described by Zoya Konstantinovna Suvorova, so I'm not going to dwell upon it. And now I would like to move on to conclusions. I know that we actually have run out of time. So summarizing all the enumerated issues, we can conclude the following. The Russian Program of Assistance to fight HIV/AIDS in Armenia is in line with the national strategy on counteracting HIV epidemic in the country. And it is still relevant, and these events are not covered by our financial sources. It is promising from the research standpoint, speaking about the study of important areas of HIV. It is focused on most vulnerable population groups in the country. These are migrants and their partners due to the main trends of HIV epidemic development and overall epidemiological space and flows of labor migration in this region as a whole and between our countries in particular. It has a systemic approach. It takes into account modern achievements, methods, and technologies that are used today to fight HIV epidemic. And it contributes to achieving the goals 90-90-90 and fulfillment of other national and international obligations. Thank you. Thanks a lot. It was a very complex presentation indeed. It was very interesting and important. I hope that we will continue our joint work to reach overall epidemiological well-being for the benefit of health of our people. Unfortunately, now I have to conclude this session because, well, we started it a bit late, and actually the organizers are saying that I should not torture the participants. And for us to remain healthy, it's also important to remember about our meals. So now I would like to invite all of you to have lunch outside. You will get it. So yes, there's food outside. So thank you once again for your very substantial and important presentations. And we will continue our joint work. And I'm sure that if someone has any questions, you will manage to ask your questions during the lunch. And after lunch, of course, we will continue discussing important topics on other parallel sessions. Thank you once again. Wish you all the best. And I would like to thank the organizers of this conference and the Federal Service on actually Russian Watchdog for Consumer Protection and Federal Vigilance Service for Human Well-being, AIDS InfoShare Foundation, and all the participants and speakers. Thank you.